Thank you very much, everybody, for joining us today. This is our second session looking at the impact of coronavirus on new mothers, and has come about after more than 200,000 people have signed the petition to extend maternity leave by 3 months with pay in light of COVID-19. So our first session took place during Maternal Mental Health Week, so it's quite fitting that the second session is taking place during Mental Health Awareness Week. So we're delighted to be joined by a number of witnesses who can talk about the mental health impacts of the lockdown on new mothers and on children. And as well as members of the Petitions Committee, I'm also pleased that we've been joined today by Alex Davies-Jones, a member of the Women and Equalities Committee. So before we start our questioning, could I just ask each of our witnesses who very kindly joined us today to introduce yourselves. So if I start with you, Sue.
Hello, my name's Sue Armstrong-Brown. I'm the Chief Executive of Adoption UK, the Adopters Charity.
Great. And Dr Seneviratne?
Morning. Hello, Catherine. I'm Dr Trudi Seneviratne, and I'm the chair of the perinatal faculty at the Royal College of Psychiatrists.
And then we have Josie Anderson. Oh, sorry, Neil.
Yes, good morning. I'm Neil Leitch. I'm the Chief Executive of the Early Years Alliance, which was formerly the Preschool Learning Alliance, and we are a membership organisation.
And Alan?
Hi, I'm Dr Alan Gregoire. I'm a perinatal psychiatrist, and I'm also the chair of the Maternal Mental Health Alliance, which is a coalition of over 100 professional and patient organisations trying to improve maternal mental health in the UK.
Thank you. And finally, Josie Anderson.
Good morning. My name is Josie Anderson. I'm the Campaigns and Policy Manager at Bliss. We're a national charity for babies born premature or sick and in need of neonatal care.
Great. Thank you very much, all of you, for being here today. So I think Catherine is going to ask the first questions this morning.
It's a Catherine handover. Thanks very much, everybody, for coming. I know you're busy people and your time's appreciated. Now, having a new baby is not easy at the best of times, and obviously we've got this awful COVID disease happening to all of us. Perhaps if I could start with Dr Trudi and then perhaps Dr Alain, if you could talk to us about the specific effects that COVID's having on mental health.
Yes, of course. Yes. So, the ONS, there was an ONS report, for example, that was published recently in March, which showed that just in the general public, there was a huge increase in anxiety. Almost 50% of those who responded talked about an increase in anxiety compared to actually figures from around a year ago in 2019, where the figure was only about 21%. So, there's a mixed picture that's happening across the country, but actually we are concerned about the increased rates of anxiety as a result of COVID across the board, in all areas of mental health, affecting everybody from cradle to grave, actually, so right across the board. And when it comes to perhaps focusing on pregnant women, and new parents, they're certainly what I'm hearing from colleagues across the country is that there is an increase in anxiety in both pregnant mothers and in new parents, and that is having an impact on their own mental well-being. And of course, there's a potential then that there's an impact on the developing children. Now, we don't have current statistics to look at the sort of epidemiological impacts of that. We conducted a survey with the Royal College of Psychiatrists, which showed very much that there was an increase in referrals. So our members reported there was an increase in referrals for urgent and emergency care. And that worries us, actually, because we're worried that there may be a tsunami of referrals for mental health difficulties on the way, because at the moment people are perhaps in isolation, not presenting with their mental health problems. and that there will be more on the way, and that includes the pregnant and the postnatal group. So, you know, we just don't know at the moment, but I think overall we're quite concerned that there is an unmet need out there that's on the way, and we haven't even started to tap into that yet.
Dr. Ellen, would you echo that? I mean, are there any specific impacts on new mothers that you'd highlight?
Yes, so we're hearing from our members, both from their anecdotal experiences, for example, member organisations that run helplines for mothers, both with very, very severe illnesses like postpartum psychosis, and those that run helplines for the so-called less severe, and by severe I'm using the term in a psychiatric sense, not meaning less individual suffering, but less need for example, hospitalization or risk of suicide. So please don't misinterpret when I say mild or moderate or less severe. But in both those areas of mental health need amongst pregnant women and new mothers, we're hearing of a huge increase, not a minor blip, but an enormous increase, possibly beyond what we're seeing in the general population. So, for example, although we have no published data on this, unpublished data from a survey of women using a pregnancy and postnatal app recently showed rates of response to a question about anxiety. The most severe level response was a lot more anxious than I would normally expect to be. 60% of women postnatally and 50% of women in pregnancy were ticking that box. This is much more than double what we would normally expect. And although we use the term colloquially anxiety in a fairly throwaway sense, that level of severity of anxiety is a genuine cause for concern in terms of the impact on the individual's functioning, the individual adult. And remember, that adult that we're talking about is doing the most difficult job that anybody in society does, far more difficult than my job, far more difficult than being an MP, and that's trying to be a good parent. And we know that none of us can fully achieve that. It's so difficult. But it is an incredibly demanding time right at the beginning of parenthood. If your mental faculties are not up to scratch, then it gets much more difficult. And the suffering cycle that takes you into can be dramatic and can lead to worse and worse and worse health, both mental and physical. But there is also then the knock-on effect on children, and that has now been well documented worldwide, consistently in all the research that has been done over the last 20 years, and the effect is not invariable, not unavoidable, not irreversible, but large. So you see a doubling overall of mental health problems in the offspring of women who are anxious, have increased anxiety during pregnancy. So for those with a lot more anxiety, that's the sort of figure we will expect to see in the next generation. And you are the first generation of legislators who has this scientific knowledge. Never previously have we known this beyond kind of old wives' tales and anecdote. We now know this as scientifically proven. We also know, as I said, that it's not irreversible. So there are things we can do, and there are things that we could do to even avoid it, because we know some of the pressures that cause anxieties like this. So there is a huge potential for acting, and acting now, to prevent effects in 20, 30 years' time, as well as effects tomorrow.
No, it's very clear, and it's very concerning. Dr. Trudi, would you say that there's a spectrum of short-term and long-term impacts here, or and where should we be immediately thinking?
Yeah, I mean, yes, definitely, because actually, as Alan has just said, we've got a huge body of evidence pre-COVID about the impact, sort of immediately, short and long term, not just on the mother, the parent, but also the developing child. So, this particular petition is about, supporting some of the more immediate factors. It's only one of many factors that may help to support families, actually. And we need to be thinking about that, because it's not just about helping that family in the short term. It's about the longer term trajectory for the mother, the father, the developing child. And so we know, for example, that there are many factors that contribute to mental health problems and mental illness. Anxiety and depression, mental health problems for mothers are very, very common. 1 in 4 mothers suffers from significant mental health problems. We now have a wave of literature that tells us actually fathers are also significantly affected. Studying suggesting, very high levels, 1 in 10 dads developing anxiety and depression, for example. So, and social factors are one of the many factors that contribute to anxiety and depression. So during times of COVID, we have issues such as social isolation that's happening. Now that's impacting on many, many levels. That's impacting on simple support systems that pregnant and postnatal women would have, which is their usual support systems from family. They're not being, they're not able to access that in quite the right, in the same way. And that will have an enormous knock-on impact. They also don't have the right level of support, even though services are trying very hard, from the usual maternity, both antenatal and postnatal services, although I know services are trying, are working at their utmost to ensure that good care continues. But the knock-on effects are that mothers, for example, are having to attend appointments on their own in isolation in some areas. They may be getting less face-to-face visits from a whole variety of professionals, from primary care, maternity, health visiting, mental health staff. The contacts have moved into a virtual way of having contacts as a way of protecting for social distancing. So that's, that's happening. So actually helping with, coming back to the issue of supporting with increased financial support, I think is really critical. That we know that concerns about financial stability, employment, all feed into developing depression and anxiety, and that can be incredibly stressful for people. And most of that doesn't present to our mental health services, or what we call our perinatal mental health services, which is when actually women reach a threshold when they develop a moderate to severe mental health problem. Much of this is managed at a primary care level and is picked up by GPs, midwives, and health visitors. So anything to alleviate that financial burden, which is, is really significant at the moment. There'll be many mothers who are being furloughed. There'll be many parents who may be at risk of losing their job. So anything that may secure or improve that financial security.
So to the topic of the, forgive me, I've got a touch of feedback. To the topic of the petition, extending the mental health leave. I mean, as part of a suite of measures, including the financial support, like the furlough scheme that you've mentioned. Is that a common effect across the whole group? Are there specific groups that are likely to benefit more from an extended mental health maternity break?
Yes, that's a really good question. The simple answer is that actually offering something right across the piece is probably the most helpful, because actually everybody probably needs additional support right now because of the complexities and the challenges they're facing. But I guess single parents would certainly require more support. So those that are struggling on their own and don't have the additional support of partners, they would be a particular area. Some of our more recent studies have suggested that younger parents are particularly vulnerable, so teenagers and young mums and fathers are particularly challenging, so it will be helpful, I guess, in that group. Having said that, we also know that older parents who face employment problems or financial difficulties, actually that can be a trigger to their mental health problems in this sort of pregnancy time and in these early years. So across the board, there's another group which needs specific attention, and Alan may want to mention this group too, which is around women who might be experiencing domestic abuse or violence and are struggling with their finances in that respect. Now it's a different group, but again, any additional funds that might support a woman in that situation can only be helpful.
I think Josie wanted to come in at this point.
Yes, good morning. I just wanted to add that, we know that research shows that parents who've had a neonatal experience are more likely to experience mental health difficulties than the general maternity population already. A Bliss survey from 2018 also showed that 80% of parents felt that their mental health became worse after a neonatal experience. Certainly what we've been hearing in light of COVID is that parents are becoming increasingly isolated. I guess we've heard from two distinct groups of parents, one being parents who are currently on the unit and who are being separated from their babies. Neonatal units have restricted levels of parental access and involvement, and in some cases that has meant that parents, invariably dads and partners, haven't been able to have access to their baby for quite some time. And we know that parents being heavily involved in their baby's care while they're in the unit is really key to reducing parental stress and anxiety and building parental confidence and that sense of being a parent before discharge. So we're certainly hearing a lot from parents who are saying they're feeling heightened anxiety, prolonged stress. I received something from a mother yesterday who was saying that she's had a headache for over a week caused by stress. And then also parents who have been discharged, as Dr. Trudi was saying, those support networks that new parents rely on their family and their friends, they're not able to access them. Neonatal outreach services have moved online, and we've heard from parents who were receiving things like face-to-face bereavement counselling after experiencing a loss on a neonatal unit, who now aren't able to access that. That's moved online, but of course it's quite a different experience. So for families with this experience in particular, it's really hitting them hard. We know that what we're really concerned about is we know that access to psychological support for parents with a neonatal experience is quite patchy. And while we don't know what the long-term impact of COVID will be, it seems to suggest that there is going to be a lot of families who need additional support just down the line, and I'm not sure those services currently exist to support the need that might need to be met.
Alan, Dr. Alan, have you got something to add as well?
I suppose
and then we'll move to Chris.
For the list of parents who are definitely worth targeting, it's parents who have more than 2 children are known to be at higher risk in terms of their mental health. So single parents, absolutely. Parents who have experienced losses or traumas in relation to the baby, parents who already have two children, but also from an economic point of view, the evidence is pretty compelling and consistent that investment in terms of both services and finance in the early years, and by early years I mean pregnancy and the first year or 2 after the birth, so really early, not 5-year-olds, the investment at that stage, including from conception, gives you the best economic returns for a population.
Sorry, can I just clarify? When you said mothers who already have 2 children, so this would be their 3rd child and beyond, is that what you're...
So mothers with 3 children or more are known to be at significantly higher risk of mental health difficulties.
Right.
Not surprisingly, you might say,
Just
but if you
outnumbered
that burden, all the economic burdens that
Mm.
come with having multiple children, the housing problems, all those social problems that come with that, the stresses and the demands have a toll on our minds and our mental functioning.
Because it's really helpful to hear, because obviously in an ideal world, everybody would get all of the support that could possibly be made available. But we clearly, it's really helpful to understand from you where the prioritization may lie, if you know, in terms of where the government can focus its support in a less than ideal world where it's not available for absolutely everybody. Dr. Allen?
Yeah, if I could just add to that, I mean, if we are looking for a priority group in our society who we should be supporting with a scheme to give them pay while they're temporarily not able to work for health reasons and for both short-term and long-term economic reasons, so that they can then return to work, we have 2 fantastic examples. One is maternity leave and the other is furloughing. And the government has already agreed to extend furloughing for a huge proportion of the population.
Mm-hmm.
Maternity leave seems to me to be the best potential targeted example. And parents surely are doing the most important job in laying the foundations for our human infrastructure for the next generation, the generation that's going to have to sort out the mess that we leave them.
Okay, so Chris, I was going to bring you in now. Have you got some questions you want to ask?
Yes, I just want to pick up on that, on our last question about the mothers with a second or third child who are suffering from mental health. And in terms of brand new mothers, is there more support for them, do you think? And that's why they don't sort of suffer so much? Or do you think it's an issue that that is across the board?
If that's addressed at me, I would say...
Sorry, I should have said that.
That generally the support available in our country compared to worldwide is fantastic.
Yeah.
From public health systems like health visitors and primary care, but it is still nothing like enough to support people with this incredibly difficult task. And the very simple evidence is the huge rates of mental health struggles that parents go through. So this is a time when we mentally struggle more than at any other time, and it's also a time when the impact of those mental health difficulties is greater than at any other time in our lives, not just on us as individuals, but on the next generation. So the level of support that's available is great from all sectors, from healthcare, social care, charitable sector, but all of those, particularly with COVID, are suffering enormously. And face-to-face support and sensitive, timely support is really important, and that's been seriously affected at the same time as the need has more than doubled.
I mean, because the reason I asked that question is I just noticed, you know, when you have your first child, there is a lot of support. I think midwives, NCT, I think do a fantastic job, that type of thing. But the second child, you seem to, you're experienced now, you know what you're doing, and you feel that it's not the priority anymore. That's the impression I have. And that's anecdotally, I'm not talking about any empirical evidence. Is that something you see as well, you know?
Certainly anecdotally, I can't think of a study that's looked at levels of support by parity, by number of children, but anecdotally one certainly hears that, and there is no evidence at all that you need less support with the number of children you have. Indeed, as I was saying, quite the opposite. If you have more children under 5, you're more at risk of that getting to you in terms of your mental health.
And just there's a quick really question about COVID-19. I mean, you know, do you see in high instances of children suffering sort of mental health problems being sort of isolated away from, you know, nurseries and schools and whatever, and that having an impact on parents as well? It's a very intense time. I mean, I can tell you from experience, it's very intense time. I'm 2 young children around, you know, and especially when there are no other outlets to to take them to, like play groups and things like that. Are you seeing higher instances of that sort of thing?
Yes, absolutely. And, you know, we absolutely anticipate, although I can't point you to hard evidence, it's only been a few weeks, so
yeah,
we don't have that, but we absolutely anticipate seeing greater difficulties amongst young children who in the near future will be attending nurseries and so on. And so this impact on the next generation, including those who are currently recently conceived and are fetuses now, I have no doubt at all that we will see an impact, and we might as well be ready for it, because, as I say, we're the first generation who has the science to know that there will be an impact. And supporting parents are the key. Parents are the ones, the people doing the parenting, they're the front line in this pandemic of impact on children. And so if we can support parents so that they can do their job as well as possible from the very earliest moment, the trajectories go like this. If you can get things right at the start, then you can set people off on the right track. So supporting parents at this stage is utterly critical.
But I suppose the $64,000 question is how do you support parents when you've got to you know, keep social distancing, you have to stay away from people. So much of this parental support is one-to-one, face-to-face. So what sort of roadmap can you see to ensure that that support is in place when we have to now do these things remotely in this new normal that we're facing at the moment?
You adapt, and parents are brilliant at adapting, and I hear fantastic stories of really effective help. For example, recently I was hearing of a health visitor who was telling me about she's trained in an intervention known as video interactive guidance, which is a fairly newly developed, very well researched, evidence-based interventions that improves the relationship between a parent and their very from birth baby. In fact, it can be done even before birth, but from birth baby, and this has lasting effects on the development of the child. Well, this health visitor had adapted to doing this remotely. And the feedback that she was getting from parents was fabulous. I mean, it was a joy to hear. So things can be done, but that health visitor did not have enough time to do it with all the mums and parents who she felt in her caseload needed it. And unfortunately, we've inherited a bit of a legacy of, not just a bit, but a legacy of huge cuts in health visiting since health visiting went over to local authorities. So they have enormous caseloads, they can't do the work, but they are, when I travel around the world doing lectures and so on, around the world, people are so jealous of our health visitor infrastructure and our GPs. You know, I hope we've learnt that we can value these, and if we can just let them go with working with parents, they can make an enormous difference. And they can do it now, and the sooner we do it, the sooner we get our returns.
Okay, fine.
That's great, thank you. I was going to bring Alex in to ask some questions now.
Thank you, Chair, and thank you for allowing me to become a guest member of this committee this morning. It's really, really important and really one close to my heart as well. And on that note, Chair, I should probably declare an interest as the Vice Chair of the All-Party Parliamentary Group on Premature and Sick Babies, so just so that's on the record as well. But My baby was born last year and unfortunately spent the first few weeks of his life in neonatal care, and it was honestly the hardest experience I've ever gone through. I cannot imagine having to have gone through that in the current situation as well. So my heart goes out to all those parents currently who were in that situation. Josie, if I can ask you, what has Bliss heard from mothers of premature babies and fathers really about the impact of coronavirus on them and their children?
Yeah, so as you said, Alex, a neonatal experience turns parents' world upside down in usual times. But COVID-19 has really impacted how neonatal services are working. Just like every other area of the NHS, neonatal services have had to adapt in order to respond effectively and safely to the risks of COVID-19. And what we saw right at the start around lockdown, so about 9 weeks ago, was parental access and involvement on neonatal units being restricted quite heavily. So it's typical at the moment for only one parent to be able to be on the unit with their baby at a time. We have seen policies where only the same parent can come on to the unit, which effectively excludes one parent entirely from care. We've heard from a father who hasn't seen his baby since the end of March. And their baby is very poorly and is expected to be in neonatal care for quite some time to come. Additionally, we've heard of policies where parents are only able to spend a couple of hours on the unit with their baby, and cases where parents of twins and multiples are having to split that time between babies or choose which baby they want to attend to on that day. And that's utterly devastating for families. For babies to have the very best developmental outcomes, both short-term and long-term, their parents need to be supported to be partners in delivering their care. We have launched a Parents Aren't Visitors campaign, and we've been really delighted to work alongside organisations like BAPM, the British Association for Perinatal Medicine, who've put out some really robust guidance to encourage units to allow as much access as possible. And of course, those decisions around parental access aren't made just by a neonatal unit. It's often a negotiation with the wider trust and infection control teams who might not understand that critical caregiving role that parents provide. But this obviously has a huge impact on families. Parents are reporting to us they're feeling increasingly isolated and increasingly stressed. It's incredibly difficult for a parent who is not able to be with their baby, but it's also very difficult for the parent who has to carry the burden of being the one who is able to go and be with their baby, who has to relay news and updates to the other parent, and they can't parent together in the usual way. Additionally, we know that neonatal care is very costly at the best of times. These services are very specialist and often located very far from homes. The parents spend around £282 every week their babies in neonatal care on food and drink, accommodation and travel. And those costs are going up. It's not as easy to access public transport. And we've heard from families who've had to set up GoFundMe accounts because they're having to travel to different cities. They're not able to stay in accommodation because it's been closed for infection control, or parents who aren't able to be with their baby at all because of the impact of costs on their family finances. And of course, the wider situation for COVID, where people's jobs are increasingly insecure. We've heard from families, mothers who are thinking they will probably have to end their maternity leave early because their partners are self-employed and they've lost all of their income. And we've also heard from parents whose babies have been discharged and are still very poorly and will need to be socially shielded for quite some time, who may not be able to return to the workforce at all. And while I think it's incredibly important, we're obviously talking about this in the context of extending maternity leave, but I think any new measures that could come through to extend leave during this time really should apply to all parents. This is affecting dads, particularly neonatal dads, incredibly hard, who may not have had much, if any, time with their baby at all during their paternity leave because of these restrictions. And also it's important that there's support available to parents regardless of their work status. This is an incredibly difficult time for parents who are self-employed or who have a work status and aren't currently entitled to any parental leave rights or pay at the moment already.
Yeah, thank you. Yeah, I totally sympathise with everybody who's going through that right now. When you do have a child who is premature or sick and has to have that time in neonatal care, you do feel like you've been robbed of that valuable time together during your maternity leave or your paternity leave. Now, this has been recognised because obviously we know there's going to be an extension to the maternity leave in 2023. But how would extended leave help parents and children now who are currently going through this with the coronavirus pandemic on top of this?
So additional leave right now would really enable both parents to play a hands-on role in delivering care to their babies. We're beginning to see units revert back to more usual parental access. And it's really important, like I say, that parents are able to provide that hands-on care. It helps to secure early attachment and good bonding, and reduces stress and anxiety in parents as well. Additionally, it's important that parents have that time, like you say, that they've effectively lost on the neonatal unit at home with their baby. And like I say, because of these restrictions, that might be the first opportunity parents could have to parent together full time and to learn about their baby, particularly at a time when services, as we've discussed, are not available at all or are being provided remotely. It's a very isolating time for families, and that's what we're hearing very strongly. Parents are feeling very isolated, and they need that time together with their family more than ever, really. And we have been absolutely delighted that the government has recognised that current parental leave laws are inadequate for families who have a neonatal experience. But really, this unprecedented situation calls for some unprecedented action, and providing a short-term emergency measure and some access to extended leave and pay will really help support families at this time.
Yeah, thanks, Josie. Sue, if I come to you now, if you could discuss what impact coronavirus and the lockdown has had on parents who are on adoption leave or going through the process of an adoption.
Certainly, thank you. So Adoption UK represents adoptive families across the UK, and we've been gathering evidence from our members and wider adoptive families about the impact of COVID on the situation they're in. It's really important to recognise what adoption is nowadays. The vast majority of children who are adopted out of care, and they have gone into care and been unable to return home because of a history of instability, abuse, neglect, inability to parent them in their birth families. So that trajectory that Dr. Anna was talking about, where good supported parenting sets a child on a particular path, that's been disrupted at an early stage. And children who are adopted are the ones who couldn't go home. So we need to understand that all of that good parenting practice at the beginning may have been disrupted or absent, and children come into adoptive families without those advantages. So adoptive parents often talk about reparenting, where their child comes home and they need to identify and understand the gaps that child's experienced and try to rehabilitate and heal as they parent their child. And there's a whole school of study around therapeutic parenting, which is a form of parenting that takes the child as they are with the early trauma that they've had and tries to help and move forward and reconnect with the child in a particular way. So it's already an incredibly important time when an adopted child comes into their adoptive families. We found last year in the biggest survey of adoptive families across the UK that's ever been done, that for families newly placed in 2018, half of adopters during that early placement period encountered quite severe mental health problems to the point of worrying that they'd done the right thing. 54% were reporting symptoms of stress, anxiety, and post-adoption depression. That's in 2018. That's 2018. Good. We did a survey last month of adoptive families' experiences in the first month of lockdown, And there we found that over half of families were reporting that their children were exhibiting increased anxiety and emotional distress. Over half were finding an increase in challenging behaviour from the children, and a third of them were experiencing an increase in violence from the children towards the parents. Those are all signs of an adopted child in trauma, dysregulated, unable to manage the situation. And we can easily understand why COVID and the lockdown is having that impact. They've experienced a high level of disruption, loss of all the external regulating activities they may have been depending on, a huge support gap opening up, quite understandably, as families struggle to access the professional support from schools, social services or medical services that they have been relying on. So we can understand the reasons, but that's been the experience, we can quantify it, and it's profound. So I think anything we can do to provide steady support to these families is going to be a very, very good investment. We've already seen a really good response actually from government recognising the vulnerability of these families with release of some funds for and a broadening of the categories of therapy that can be or support that can be made available to these families. So that's very good. But when it comes to supporting early placed families right now, there are more opportunities that we can take. We have seen that there are some existing aspects of guidance around early placement, which we think aren't quite working. So adoptive families often experience quite a lot of isolation when they're first placed because of guidance that says this child doesn't know who their parent is, they don't have a strong attachment model, they need to be given time to settle in their new family. And the unintended consequence of that has been a sense of isolation and lack of support for the parents. So we need to look at that again, and we need to particularly look at it in the light of the impact of the COVID lockdown, which is just reinforcing that sense of isolation and lack of support. What we found is that access to a community of adopters, so that new parents have got can talk to people who understand what they're going through and the uniqueness of the adoption situation, is really, really important and can go a long way to allowing people to sort of talk to others, gain experience from others who perhaps are further along in their adopted journeys, and have a roadmap, because it's very difficult. Everyone says if you have a toddler melting down, toddlers melt down. That's just what they do. That's what kids do. They have tantrums. Yeah,
I know that.
Do they have them for 5 hours? Do they never sleep? Do they have to have all their meals under the table? You know, what's normal and what isn't? And it's very, very hard for adopters in the kind of top trumps of difficult parenting conversations that everybody has to know where they need help, where the situation they're encountering is more challenging than it should be, and what they should do about it. So access to that community of adopters is something that can still be provided during COVID. And access to online virtual support really needs to be something that is made much more readily available. There's been good strides in that direction, but we need to look at adoptive families with a presumption that they are most likely to need support and ensure that it's provided. For all the reasons that previous witnesses have said, this is one of the best investments we can make in the future stability of these families.
Yeah, thank you, of course. And I suppose one of the best things that can come out of all this is that even when things do return to normal, whatever normal looks like, is that these online resources are still available for people, even when that face-to-face interaction returns, because I think they've been proven to be quite invaluable at the moment.
They have. The experience that my organisation has had is that we can't keep up with demand. People really want to have webinars, virtual meetups, access to expert speakers, and I think that appetite is now there. We will do our bit to continue to provide it, but I think it's a new channel to reach vulnerable families. The other thing I would say is that all of the things that previous witnesses have said about instability and parents' access to earning exist for adopters. For single adopters where there's no other parent, even single parents who are birth parents usually, not always, but usually have another birth parent somewhere that may be providing financial support or some respite. Adoptive single parents don't have that at all. And we need to look very carefully at the stability of those families. And there are some inequalities that we could correct now. So for example, self-employed adopters do not have the same entitlement to statutory parental allowances and leave as self-employed birth parents do. That's an anomaly and it could be corrected. It needs to be corrected. special guardians who are birth family members who take on a child to act as their parent when a birth family member cannot continue as that child's parent, don't have any of the same access to parental leave and entitlements as adopters do. So that needs to be evened up. That's a very, very important route out of care for children, and it needs to be enabled. We know that around half of kinship carers need to give up work when they take on their niece, nephew, grandchild, whoever it is, and don't have access to that same set of entitlements, and need it because those families have all the same needs and all the same previous trauma as adoptive families. So we could look at that. That's something that could be done. One of the things that we have found, very encouragingly actually, is that during lockdown, we have seen this increase in difficult experience and challenging behaviour arising from the restrictions. But we've also seen around half of families reporting strengthened relationships between parents and children as a result of the increased time at home with them.
Yeah.
Now that, as everyone will recognise, isn't completely straightforward, but we have seen that there's a benefit to parents and children having some freedom from external pressures and more time together. I think we absolutely must capitalise on that, because that's the crucial bit of reparenting that we can build in for vulnerable families right at the start. If people aren't rushing back to work and they have a little bit longer to stabilise their child in their new family and start to form those trusting bonds, we'll reap that benefit. At the moment, we're seeing that in some cases, especially in two-parent families, a lot of the parental leave is actually used up earlier before the placement on introductions, because there has to be a process of the child in foster care getting to know the adoptive parents. If a lot of the leave is used up there, it's not available for that crucial reconnecting, settling in and bonding and attachment time after the child comes home. So I think there's a very strong case for looking at enhanced parental leave time and allowances to ensure adoptive families get off to that strong start.
Yeah, thank you. Well, you've just answered my next question, which was how could extended leave help parents and children who are going through the adoption? So I don't know if there's anything else you wanted to extend on that, but I wanted to come back to the anomaly you just raised regarding the furlough and self-employed parents who are going through adoption, and the anomaly and they're falling through the gap there. Has this been raised by your organisation with the Chancellor and the government? And if so, have you had a response? Is it being addressed?
It's been raised repeatedly over a number of years. I think that perhaps it's not ever had enough weight on its own to merit the legislative hoops that need to be jumped through, but it is not an invisible issue. It's an anomaly, and it seriously needs attention and needs to be corrected. We need to recognise that adoption is a critical route out of care for children, and where we can spot these barriers, even if it is, frankly, a small number of families and quite a bit of a pain to correct them, we absolutely must do it, because it's an even bigger pain and an even greater number of families if children cannot come out of care and into the adoptive homes that they need, because a multiplicity of self-employed or single adopters are not able to make the financial case to do it. That's a ludicrous barrier to allow to remain.
Yeah, thank you. Final question from me. Is there anything that parents who are going through this process now or have recently adopted should be doing differently that might not be blaringly obvious to them, or is there anything that you can advise or suggest for them?
At the moment, parents who are prospective adopters who are going through the process are facing a really difficult time. There's a huge emotional component to deciding to adopt. You don't know your child, you're out of control, you're a supplicant in the system, and then to have all of this going on, disrupting adoption pathways is really difficult. So we know that a lot of hopeful adoptive parents are very, very worried at the moment. My advice to them and to newly placed adopters who are just in free fall with no job security and lack of connection to their friends and family network is to get in touch with their local adoptive community. They can get in touch with us and we can bring them into all of our groups, but there will be, via their agencies, there will probably be some groups and some support available as well. So the most important thing is not to try to go through this alone. It's a very difficult thing to do. And there are people who are going through the same experience and can share some of that with them.
Thank you very much. Thank you, Chair. No more questions from me.
Yeah, thank you. And I'm really pleased, actually, Sue, that you raised the issue of kinship carers, because, I mean, just to declare an interest, I am chair of a task force group in Parliament that's looking at some of the challenges that kinship carers face, and And I think one of the aspects that people don't realise is that quite often they are grandparents that have taken in very young children. And so the additional challenge of this dreadful virus is that quite often they're having to shield, as well as all the challenges of, in effect, being a new parent of a quite often challenging situation that a child may well have come from. So it's important that you have included that within some of your thinking as well, and that's really helpful for this discussion as well. So thank you. I was going to bring Mike in now, if he's here. Yes, brilliant. Do you want to ask your question, Mike?
Thank you, Chair. My questions are to Neil from the Early Years Alliance. What has the impact of COVID-19 been on the childcare sector? And in particular, Neil, what are the main challenges for the childcare sector when planning to reopen in June?
Of course, and thank you for that question. I have to say, if I may preface this, I was greatly appreciative of Alain's comment about the return on human capital investment being the greatest in the early years. I mean, it was like manna from heaven hearing that. All the evidence shows that. But unfortunately, I'm afraid that we do the reverse. We invest considerably more into secondary education, state education, and higher education. So to give some context to your question, before coronavirus, I have to say, in many parts, the sector was in a very difficult position. We already had a position whereby, for example, we have a shortfall on the free entitlements by research by the independent analyst CEDA, showing that £824 million is the shortfall. We have the Her Majesty's Chief Inspector of Ofsted responding to a parliamentary question last year, telling Parliament that 500 providers every single month were leaving the sector. And we've just done a recent survey of 3,000 responses, which show that around 25%, so 1 in 4 providers, is unlikely to be open in 12 months' time. So I think to try and give some context to where the sector was and currently is, hopefully that helps. In terms of funding, I think it's been pretty disastrous for us. We are seeing a situation where right at the outset, we were led to believe that we could access 2 particular streams of funding without any caveats whatsoever, without going into the detail. You know, the evidence has been submitted to you, but a month later, after constantly asking, is this the case? Because it seemed too good to be true to a degree. And we also had heard rumors that actually there may be changes to it. We were told, no, this is not the case. And yet 75% of providers had made decisions in terms of laying people off, paying them additional salaries, whatever it happened to be, on the basis that they would have access to both those funds. When it was corrected, it wasn't retrospective in as much as, you know, nobody said, okay, what's gone before, we will honor that. It was basically, you're left on your own. So I think at the moment for early years providers, they're feeling somewhat, if you like, marginalized. When it suits, and I have to say this, we're lumped in with schools. When the call came out for us to basically come to the fore, physically, people to risk their health, we were there. As at last week, 37% of nurseries are open, taking 1 or 2, maybe 3, 4, 5 children, but certainly in many cases, not much more than that. So they've done their bit. And yet when it comes to funding, we have been marginalised. So we were in a difficult position, and it's going to get worse.
So I recognise that, and I know from my own constituency that there are nurseries that are on the brink of closure. And you're right, they've kept open for key workers all the way through this. But in that context then, Neil, is there anything else that the government should be doing to support the childcare sector?
You should be giving transition funding. Almost every single day, we ask government, we're going to have to open up our nurseries, and childminders are opening up their doors. And they've been doing this all the way along, but even more will open. And what we're saying is they're going to have to unfurlough staff. They're going to have disproportionate costs. So they will have premises costs, they will have people costs, with a considerably reduced number of parents bringing their children into those settings. It needs additional support. And it seems to me that more support is given to, retail and hospitality, etc. And yet this is part of our social fabric. It's part of our social infrastructure. And yet we are being left to find our own way. And at some point, these settings and these childminders will be critical, because we'll have a situation where we're trying to recover from a very difficult economic position. You'll need people to get back into the working environment, and you will find that settings will have closed. And the other problem is they may well have closed where they are needed most. And by that, I mean the most disadvantaged areas. I talk to nursery owners seriously on a daily basis, and they're telling me they've been in this sector for 28, one for 50 years, and they're now having to close their doors. Where are they located? I would suggest where the need is greatest in terms of social mobility. And we were talking about anxious parents, which leads to anxious children. Surely that's where we should be prioritizing our resources.
Thank you very much, Neil. That's very, very passionately put. And I thank you. I've got another question for all witnesses now, if I may. How important is it for parents to have time to search for and visit appropriate childcare settings, or for babies to form a relationship with extended family members or childminders before they're left with them? Can somebody answer that one?
Sue, do you want to come in?
Thank you. It's a really important point that Neil and Mike have both raised, the idea of transition. So I'm talking from the perspective of children who've experienced early disruption, where all these issues are probably heightened. But children who have come through the care system have experienced a high level of instability, and all children are not programmed to move around between carers. They're programmed to have a firm attachment to a small number of people who they're safe with. So it has to be handled with a great deal of respect and expertise if you're going to start expecting a child to thrive and be happy and confident in a new setting. And that's why I completely agree with Neil. The vast importance of early years settings should be recognised. As we're facing at some point in the future a transition out of lockdown, and children start to return, either come into daycare for the first time or go back to school, we absolutely must see a lot of attention being given to supported transition, especially for vulnerable children for whom instability and change is a huge threat and could be a big trigger for further mental health problems or behavioural challenges. And we're asking for this to be formally acknowledged and for schools to be given support. And having heard from Neil, I think we'd probably extend that to early years as well. This needs to be a process that's invested in, and children need help to come out of a time when they're being quite isolated. They're not being socialised. Some children need extra help with that anyway as a result of their experiences. So they can't just be dropped back into school and back into nurseries and expect that to be fine. We need to have a transition plan and additional support for the families whose children are going to struggle most with that.
But the big challenge, sorry Mike, I was just going to comment, is that the big challenge is that these childcare settings are not what we recognise anyway, in terms of the measures that are having to be put in place to enable them to be safe at the moment in what is becoming, the new normal. And that's an extra challenge in terms of capacity of childcare providers, which I'm sure, Neil, you'll be able to comment on, but also that confidence of parents, which I'm sure, Dr. Allen, you'll be aware of, that there's a big anxiety attached to leaving your child in a childcare setting. So not only, as you said, Sue, it's from the child's perspective to make sure that they feel safe and secure, and how that's going to look in the current situation where there may well be levels of PPE, there may well be social distancing. That all needs to be worked out still, as far as I understand. But also that ability for parents to visit the setting, be aware of how it works, feel comfortable with it, and be confident and not have that anxiety about leaving their child. I think all of these things have extra challenges in the current situation. I'd be interested to hear the experts' views on that. Dr. Allen.
Yes, so from birth, children learn what is safe and what is dangerous in life from their primary carers principally their parents or their adoptive parents. This learning, fairly obviously you might think, but we need to remind ourselves sometimes they carry for the rest of their lives. So we know that children from birth and indeed from before, whose parents are extremely anxious, will learn abnormal anxious responses to normal situations, and that does not lead for well-functioning adults. So the highest risk for mental illness that we know of actually comes from disrupted childhoods, and indeed the highest risk for physical illness. So I'm sure that everybody has heard of adverse childhood experiences and the impact that that has on health. If just in this tiny example of early childcare settings, parents are anxious and do not have the time and the support to engage their children into those settings, those children will carry with them an anxiety about those settings, which will give extra challenges to the settings that are already facing difficulties. So we are creating a situation from the very start that is going to snowball into all sorts of difficulties. So all the support that we can give to parents, financial and social, and to the settings that support them, is going to make a big difference to the short-term and the long-term outcomes.
I was just going to bring Neil back in, and then Josie, I know you want to say something too. So Neil, were you going to talk about it from a practical perspective, how nurseries are managing these situations?
Yeah, I was just going to say that, you know, we're used to controlling our own destiny, and it's quite interesting to reassure parents that actually we, for weeks now, as a sector, have been shaping what good practice looks like, what low risk in terms of transmission looks like. And so we're really comfortable that we will only accommodate numbers that we feel safe with, and that basically practices will be there. And we have been quite stringent in that, way ahead of, dare I say, government or any other body. So we're in control of it, and parents really should not fear.
Okay, that's helpful, thank you. And Josie?
Just on the point around access to childcare and the importance for parents to be able to assess those settings. For babies who are discharged with quite a high level of medical needs, it can be really challenging to find appropriate childcare anyway. This is one of the reasons why many people have campaigned for so long for extended leave, because it would allow mothers in particular to have more time with their baby, to allow them to become ready for childcare. So particularly for babies who are born premature and who develop according to their due date rather than their birth date, so their corrected age. Many parents don't feel comfortable putting their child in a childcare setting before they've reached certain developmental milestones. What we've been hearing from parents over the last few days and weeks is that their children are vulnerable and are being told to shield, so won't be able to access childcare anytime soon anyway, and that's putting them in quite a difficult position in terms of their work. And like I've said, we've heard from some mums who are already thinking they probably won't be able to return to the workforce. And in terms of your point about the importance of babies building up those bonds, I guess, with other members of the family, in pre-COVID times, in usual neonatal settings, parents will have unrestricted access to their babies, and also siblings and other family members can also come onto the unit at other times during more standard visiting hours, and that's not able to happen at the moment. So many older brothers and sisters may not have seen or even met their new baby brother or sister at all before the point that they're discharged, and same with grandparents and wider family members too. So again, it's really important that families have that time at home to adjust to being at home, which is already a difficult transition anyway, going from a clinical setting to a home environment. But yeah, it's just even more difficult at this time.
So, Mike, I'll come back to you, and then we'll.
Yeah. It's the last question. It really does follow on from the questions that you've already raised, Chair, and Jodie's just picked up on this to a degree. But on the petition for the extension of maternity leave, we did. Our wonderful staff did survey petitioners, and 77% of those told us that they've not been able to find suitable childcare to allow them to return to work. And I'm wondering what the panel think about the difficulties of people finding childcare due to COVID-19 and yet being under pressure to actually return to work. And Jodie has touched on this. So, Dr. Allen, how about?
I don't have any data on this issue, but clearly it's an extremely difficult challenge at the moment. And if, from a mental health perspective, it is a source of one of the greatest sources of anxiety that parents have, very understandably. And if they haven't had time to develop a secure relationship with their baby, that makes it all the more difficult. So having both the time to find a setting that they feel confident with, and that it's not just the COVID issue. Yes, that's one of the things that just adds to it, but parents need to do some choosing. There is a personal element to this, and they know their babies and their relationship with their babies. So they need both the time for that, but they need the time to develop this confident relationship. And then they need alternatives as well. So just having a childcare setting is usually not enough in itself for a return to work. You need the support of others who might pick them up, or grandparents who might pick them up and drop them off at particular times because work doesn't perfectly fit in. And that at the moment is for many parents not possible. Having other friends who are parents, so having that social network of parents is critically important, both for the parents' mental health, but also for their practical arrangements. And that is really difficult to form, takes much longer at the moment to get to know other parents with similar age children in the locality. Critically important, those social networks, and they are very challenged at the moment.
Thank you. Neil, any comments on that?
Well, I think from a practical point of view, providers, childminders and nurseries would do all that they can to basically support parents where they are looking for places. And the difficulty will be, of course, that at this particular point in time, in trying to operate some social distancing and obviously operating in bubbles, small groups of children to keep the risk down, then, staff, I guess, will be fully occupied. So I wouldn't try and claim that it's going to be as it was before at this point in time. But I do know this, that the early years practitioners will respond and will try and support parents as best they can. It's our history. That's what we've always done. It wouldn't change.
Thank you, sir. And Jodie, finally. Thank you, Chair. Last question, Jodie. Thank you.
So, I was just going to add something there, Neil, because I appreciate that you speak very passionately and advocate very strongly for nurseries and childminder settings. But from my constituency postbox, and this is no criticism of nurseries or childminders, but parents have found themselves in the situation where the childcare that they would normally use has simply not been available, and many have had to find alternatives. And there's been a big shift during this period, even for key workers, to find the appropriate childcare. And that's because, and my understanding is that childminders have not been allowed to operate at all up until this point, even where they deemed it to be safe because they only had one child in their care, but that was deemed unsafe. Whereas nurseries have continued to operate throughout, those that can, and to be able to provide the support for key workers. So I just wondered if you had any comments on that, and in terms of how you see that transition, because where parents have perhaps found a temporary solution during this period, they may well want to stay with that rather than move their child again. Or alternatively, I mean, how's it looking for the sector in terms of what is the new normal and how is that going to look? Because I think that is the big challenge for many parents and a big cause of anxiety at the moment.
Well, none of this is an exact science. So my comments, I have to say, are of a general nature. I mean, you know, if we're told to lock down other than for essential workers, I'm afraid that's what we've had to do. And disproportionate numbers, as I say, of providers have stayed open in trying to do their bit. Moving forward, I do know, again, in conversation, that many providers will be anxious to try and get the numbers back into their settings, but they won't do it at the risk of basically, you know, doing the wrong thing in terms of practice. So that there is a conflict, but I know which side of that conflict that they will fall upon. It's a parent's choice in terms of what they want to do with their child. And, you know, I would be the last person that would say, you must put your child with a childminder, you must put your child with a nursery. We know the benefits. We know the benefits. Society knows the benefits of social interaction, the care that providers, early years providers can give. So it has an important role to play, but it's not wholly and exclusively the answer for caring for young children. It's about context, proportionality, and parental choice.
Yeah, no, I mean, I completely take that on board, but I think the issues that Dr. Allen raised are really, really key, that quite often childcare is a jigsaw for many families, and there is perhaps some childminding, some nursery, and an awful lot of extended family as well, all of which is compromised in the current situation. And I think is key to understanding particularly how the petitioners have responded to us. Many have fed back that 81% are considering delaying their return to work because they cannot find the childcare, or they're not confident about finding the childcare that's needed for them to return to work, and all the knock-on implications of that for family finances and for mental health and anxiety. So I think you want to come back on that, Neil?
I was just going to say that the solution to this is investment, and it is transitional funding. This is not difficult. This really isn't difficult. It is that if you want providers to respond, to open up their doors, to open up for longer hours, they need to be adequately funded. And this must be a priority. It must be a priority. It can no longer be put at the bottom of the pile. This particular pandemic has demonstrated the social, if you like, value of early years. Never has it been, if you like, so prominent as now. We should grasp this moment, realize that we've faulted in the past, and put it right.
Okay, thank you, Neil. So I'm going to bring Martin in now, who's got some questions. The final questions.
Yeah, thank you. Along with or instead of the potential increase to maternity leave, what do each of the witnesses think that the government could be doing for expectant parents, new parents, and those attempting to return to the workplace?
Who would like to come in first? Josie and then Dr. Trudi.
So, as I think I've mentioned, we've launched a Parents Aren't Visitors campaign, and one element of that is calling for the rapid introduction of extended leave to support families. But really, that needs to be part of a package of support to enable parents to maximise the opportunities they have to be with their baby right now. So additionally, we think that there is need for more financial support, so a nationally coordinated fund to help families with subsistence costs. There's precedence for this already. The Neonatal Expenses Fund has existed in Scotland since 2018. And one of the evaluation documents from that has found parents felt that it helped them baby and reduce their anxieties around finances, which might have impacted their ability to be with their baby as well. And we'd also like to, in line with BACM guidance, see parents who are suspected to have COVID-19 or living with someone suspected to have COVID-19 to have access to rapid testing. So understandably, parents in that situation aren't able to go onto the neonatal unit at all, and in line with public health guidance will have to self-isolate, meaning they may be separated from their baby for up to 14 days. And some neonatal units are able to provide rapid testing, which can dramatically cut that length of separation down if a negative test is returned. And we'd really like to see the government supporting the health service to enable those tests to be available more widely, so that any unnecessary separation during this time is stripped out. And just one final point, really, when we've been talking about the impact of leave for families, one thing that we found, particularly for dads and partners, is an increased rate in them taking sickness absence. So a survey we conducted last year found that about just over a third of dads and partners had taken sick leave, which is obviously more costly to employers because they can't reclaim any of that back in the same way that they can with parental leave pay, and is more difficult to manage. So having access to leave and pay, which is formally recognised as parental leave, is easier all round for families and employers to manage.
Okay, thank you. And Dr. Trudi?
Yes, thank you. It's been a really important discussion this morning. Just to add to lots of comments everyone has made, I think just reiterating the point, but also reminding us that actually many of the women that we see in our services, this anxiety about maternity pay and the length of pay and how much time they have off starts in pregnancy. And that's a really important point to hold on, because as that anxiety increases in pregnancy, there's then a potential impact on the developing baby, which we know that trajectory is not helpful. It's not good for the developing fetus. So we know that. So just really to say that I think this extension of maternity pay, I think would offer some security for women right at the start, and for parents right at the start, so that they don't develop that anxiety as the pregnancy progresses. Because there is something about knowing that there's something in place postnatally that reduces anxiety antenatally. I think then moving on, I think actually supporting parents' mental health is critical, because we know that, again, parents' mental health has a direct impact on the mental health and well-being of children. So just continuing all the plans that have been developed. So the long-term plan, for example, for mental health and in improving funds for mental health, we would really very much like to make sure that those plans continue and that they're not perhaps lost in the COVID recovery plans. I think it's really important that those plans that have been put in place to extend mental health services right across the board, which will of course support parents, that continues. And then, luckily in perinatal mental health, actually we've been fortunate, because actually this research and the voice of people resulted in an investment in funds for perinatal mental health services, so for mental health services in pregnancy and postnatally. And there's a plan to extend that and to looking after families until the children hits 2, for example. I'd like to just pick up on the work of everybody, but particularly Neil. The perinatal and early years period we know is critical for the longer term well-being of children. So just emphasising that. So additional funds, I think, that bridge that perinatal early years bit, that chunk of time, I think is critical for government to think about the collective funding across the board for the perinatal and early years, because that sets out the footprint for people's mental health for the rest of their lives. So I agree with all the comments that have been made about really securing good joint up care across our health and social care and our childcare sectors in these early years, and completely echo what Neil says, that this is an opportunity to really change what the UK is offering. I think we are good with our maternity pay. I think we are good, but actually we're not the best in the world, and there are many countries that are offering much greater maternity joint parental funding for leave, up to 80% or 80 weeks in some places. Estonia, for example. Many countries in Europe are offering longer paid maternity and shared parental leave, which then has that knock-on effect of supporting the mental well-being of parents. So I'll stop there.
Yeah, thank you. And Sue, I think, wanted to come in as well.
Yes, thank you. Just to two final points that have built on what has been a really interesting discussion. One is around a fairly immediate, wider set of context that this debate around supporting that early period of the life of a family sits in, particularly for these vulnerable families. We're looking at a toxic trio right now under the pandemic, with increased alcohol consumption, increased domestic abuse rates, and increased violence and mental health problems, all going up. Those are known to be the things that drive children into care. So we're likely to be looking at a bulge in the care population as a result of this. It's going to be fantastically important that we provide those children with safe routes to wherever they need to be, which might be back to the birth family with appropriate support there, might be into a kinship care placement, might be into adoption, and might be into a longer term foster care placement. But either way, we need to understand, for all the reasons that have been said, that early trauma to a child has a lifelong consequence unless investment is made very rapidly. And what we need to do, alongside the really good suggestions around enhanced parental leave and support, is to put in place a presumption that children who've undergone this sort of trauma and instability in their very, very earliest lives need to have support presumed rather than only provided when that family reaches a crisis point. There needs to be a presumption of wider support there. And there needs to be recognition of that critical role that the wider community, the friends and family and the social network will play, and support for people. I talk from the adoption perspective, but it will apply to kinship carers and others as well. Support for those, and that to be taken as a fundamental plank of supporting families rather than as a nice to have and you can probably sort it out type of thing. So that's the first point. I think there's a wider context to this debate, which is really important. The second one is that I think we have learned a lot about the real life balances that parents have during this pandemic, and particularly around flexibility. There have been some fantastic examples of employers understanding about the need to keep the business going, but also to allow for the fact that a lot of employees are juggling families and caring responsibilities at home while schools and childcare settings are closed. And I think we need to take that learning forward. We don't need to go back to that black and white, you're either at work or you're at home and don't bring your family's needs into work frame that a lot of parents struggle with. A lot of adoptive parents particularly struggle with, because their children have complex needs and don't often understand that the work is the work and the home is the home. They just see separation and trauma and loss every time the parent goes to work. So I think we've got some opportunities to build a much healthier workplace for all families, and that is going to allow a blueprint to develop for children to understand about work, endeavour, and parents to feel that they can get that personal fulfilment while not sacrificing their family lives. So I think there's a big opportunity, probably the subject of a whole new inquiry, but I'd like to just mark it down as something we should learn from.
Thank you very much. So we've got a couple of minutes left, Martin. I know Dr. Allen just indicated he'd like to come in as well, but did you want to incorporate any comments with your final question? Have you got another question to ask?
Yes, just briefly, I think almost everybody's touched on the mental health issues in answering that. So really just to add in, if there's anything else that new parents are missing out on as a result of the lockdown that could help in that regard.
Great. And if people could sort of answer that and make any final comments, because we really just have a couple of minutes left. Should we go to you first, Dr. Allen?
Yes, I wish I could give you one single action that would solve all these problems, but I'm afraid that there isn't one single action. But I agree with the other witnesses that there is a simple solution, which is that we need to make use of that extraordinary proportion of our population who are naturally hugely motivated to do the right thing if only we can unleash them, and that's parents who want the best possible futures for their children. And what we need to do simply, and it is really simple even though it involves multiple actions, is we need to support them, we need to trust them, and we need to invest in them. I'm sorry, there's no getting away from it. Hopefully we've learnt in this pandemic that carers are critically important and have been hugely undervalued. These parents are caring for the next generation. They need their minds to be in the best possible level of functioning it can possibly be. And if we burden them with barriers and challenges instead of supporting them with facilitation, both economic and human support, practical and emotional, we will unleash a fantastic future for the next generation. And the science, this sounds woolly and wishy-washy, it isn't. The science tells us this, and we can on the back of an envelope, you could draw up a blueprint for a better future for our society. And so much is being learnt during COVID. Let's use it. Let's have a fantastic future for them.
Thank you, Dr. Allen. I think that's a really positive, but also it's a challenge to us, a note to end on, which I think is relevant for all times, but particularly these challenging times at the moment. So I just want to say thank you to all of you witnesses. This has been an incredibly rich session, and it doesn't end here. If you have more thoughts, thinking, oh, I could have said that, or I should have said that, or I didn't point that out, we are more than happy to take written submissions as evidence, and it will all get incorporated into our considerations and a report that we will produce. So just thank you very much for your time at the moment this morning, because I know it's valuable, and we're very, very grateful. And watch this space as well for how your thoughts and contributions will become part of the report that comes out of this session as well. So we're actually going to move on to our next session, which is on tackling online abuse. So we'll say goodbye to our witnesses and hopefully welcome our next witness, and goodbye to Alex as well. Thank you for joining us as a guest this morning. Thank you very much, everybody. So we'll just have a 2-minute break before we start our next session. So thank you.
Band-Aid.